I'm Dr. Chip Levy. I'm professor of medicine at the John Ochsner Heart and Vascular Institute, Ochsner Clinical School, the University of Queensland School of Medicine in New Orleans, Louisiana. But I'm here today at the Mayo Clinic in Rochester, Minnesota, in the offices of the Mayo Clinic Proceedings. I'm here for the annual editorial board meeting where I serve as one of the associate editors and the cardiovascular section editor. But I'm here now to discuss our manuscript entitled Physical Activity Promotion in the Healthcare System, which will appear in an upcoming issue of the Mayo Clinic Proceedings. It's an honor for me to co-author this paper with two esteemed authors who for many decades have been some of the leaders in the world in the field of exercise scientists. The first author is Dr. Ilkka Vuori of Tampere, Finland. He's a well-known physician and scientist who's lectured and taught around the world, particularly in Europe. And the senior author is Dr. Stephen Blair of the Department of Exercise Sciences, Arnold School of Public Health in the University of South Carolina, Columbia, South Carolina. He's also considered by many to be the father of aerobic fitness, and he's been the lead author for decades of the prestigious Aerobic Center longitudinal study, which has countless manuscripts in the medical literature, including a number of major ones in recent years in the Mayo Clinic Proceedings. I think it's well known that most Americans, and in fact probably most people around the entire Western world, do not achieve adequate levels of physical activity. And it's well known that physical inactivity is one of the major risk factors for a number of chronic diseases. This is certainly true for obesity, diabetes, for many cancers, and especially for cardiovascular diseases. Now, my co-authors and I have between us published probably 1,000 manuscripts, and many of those have been on the theme of physical activity, exercise training, and the importance of cardiorespiratory fitness. And certainly we've demonstrated that cardiorespiratory fitness is a major factor that affects the other cardiovascular risk factors, but it also directly contributes to cardiovascular disease and cardiovascular disease mortality and all-cause mortality. We've also contributed a lot of information on the fitness-fatness debate, and in this regard we've demonstrated that cardiorespiratory fitness may be one of the strongest and perhaps the strongest cardiovascular risk factor. In this regard, there's substantial data that indicates that fit individuals with a number of chronic diseases, this is true for metabolic syndrome, diabetes, hypertension, and obesity, that they actually have a better prognosis than do unfit individuals who don't have these chronic conditions, showing just how important fitness is as a major cardiovascular risk factor. Now, certainly there is a component of fitness that comes from genetics, but most of fitness comes from environmental factors, particularly the amount of physical activity and exercise training one performs. And that's why it's so important for physicians to routinely recommend physical activity throughout the healthcare system. And most clinicians can share in the burden of making this recommendation, but this probably primarily falls on primary care physicians, including general internal medicine specialists and subspecialists in the internal medicine fields. Now, currently, federal physical activity guidelines suggest that all individuals should be doing about 150 minutes per week of moderate physical activity or 75 minutes per week of vigorous physical activity. And the Institute of Medicine actually suggests that all individuals should be performing about 60 minutes of physical activity on most days. But the fact is, very few are coming close to achieving these goals. And Dr. Steve Blair and I have several recent publications that have indicated that during the past 5 decades, there have been marked declines in occupational and household management physical activity. So that even if the national guidelines were met, we still wouldn't be coming close to making up for the very marked decrease that's occurred in the last 5 decades in these other types of physical activity. So this further emphasizes the need for physicians and clinicians in the healthcare system to be routinely recommending physical activity to our patients. In our manuscript, we discuss the fact that most physicians do not document physical activity, and most do not assess physical activity or give any recommendations to increase physical activity or to prescribe exercise training to their patients. And in fact, when the clinicians are questioned, many of them will state that they don't feel they have adequate training or that they really have the capabilities of making good physical activity recommendations or giving a good exercise prescription to most of their patients. And therefore, in our manuscript, we provide a call to action at a national and international level to increase the promotion of physical activity throughout the healthcare system. We provide guidance for all medical education institutions. This includes medical schools as well as places that have residency programs and fellowship programs to allow them to increase the training of their students and trainees and fellows in the prescription of physical activity and exercise training. We provide a lot of background information in this area, but in addition, we specifically deal with 5 areas. First, the factors that increase and the factors that hinder the advising of physical activity and exercise training throughout the healthcare system. Second, the efficacy of advising physical activity and exercise training. Third, the effectiveness and feasibility of providing these physical activity and exercise training recommendations. Fourth, the effectiveness and efficacy of the exercise training prescription. And finally, 5, the cost effectiveness of providing physical activity promotion in the primary healthcare system. Because exercise is medicine, we believe that the recommendations for physical activity and exercise training should be seen and dealt with in a similar way to the efforts given to such things as pharmaceuticals or other therapeutics or other interventions, at least with regard to the basic and continuing medical education and the training that's involved, to allow clinicians to adequately assess, prescribe, and deliver this therapy, and to get reimbursement that's appropriate for the time spent in these activities. There also should be sufficient funding to study, from a research standpoint, the efficacy, the feasibility, the effectiveness, and the interactions and comparability with other important modalities, including preventive therapies, rehabilitation modalities, other therapeutics. And in order to make these changes happen, it is essential that there be credible, strong, and skillful support of these efforts throughout the medical community and throughout the healthcare system. And only with these great efforts are we going to take the promotion of physical activity to a higher level throughout our modern healthcare system. Thank you very much.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.